Your body is basically a fortress, and it's constantly being attacked by invaders like bacteria and viruses. Guarding those walls is your immune system, this incredibly smart and powerful defense force. But what happens when that army mistakes something totally harmless, like pollen or a peanut, for a deadly enemy? Well, it turns its weapons on itself. It's basically a case of friendly fire, and it can have some really serious consequences. In this explainer, we're going to dive into how our body's greatest protector can sometimes become its own worst enemy. So here's our game plan. First, we'll meet the defenders of this fortress. Then we'll check out their specialized weapons, the antibody arsenal. From there, we'll get into what happens when this amazing system goes a little haywire, including the ultimate emergency, anaphylaxis. And finally, we'll look at how we figure all this out and, on the flip side, what happens when the fortress defenses are a little too weak. All right, let's get into it. First up, we're meeting the command structure of your internal army. Because, to really get what goes wrong, you first have to understand how it's all supposed to work in the first place. Okay, so take a look at this. This basically maps out the two main branches of our immune system's special forces. Everything kicks off in the bone marrow, and from there we get two key types of soldiers, B cells and T cells. Just think of the B cells as your intelligence agency. They're in charge of what's called the humoral response. They create antibodies. We'll talk more about those targeted missiles in a bit. T cells, on the other hand, they're your ground troops. They lead the cellular response and get right into hand-to-hand combat with the enemy. So how does this whole fortress actually defend itself? Well, it's really in three main ways. First, you've got your innate immunity. These are like the guards already on the wall, the immediate, general-purpose defense system you're born with. Then there's adaptive immunity. Think of these as your elite spies. They learn, they adapt, and most importantly, they remember specific enemies. This is what gives you long-term protection. And finally, you've got passive immunity, which is kind of like getting temporary backup from an ally, like the antibodies a baby gets from its mother. It's borrowed, but it works. Now, let's zoom in on those specific weapons made by the B cells. These aren't just generic cannons. They are highly specialized proteins called immunoglobulins, or as most of us call them, antibodies. This chart tells a really interesting story right away. You can see the clear workhorse, IgG. It makes up a massive 75% of the antibodies in our system. But look closer. See that tiny, almost invisible sliver? The 0.004%? That's IgE. And believe it or not, despite being so rare, it's the main character in our story about allergies. So each of these immunoglobulins has a very specific job. IgG is your main security patrol, cruising through your blood. IgA is like the bouncer at the gates, guarding your nose, your gut. IgM is the SWAT team, the first one on the scene of a new infection. IgD, well, it's a bit of a mystery, honestly. But IgE, its official role is to participate in allergic and hypersensitivity reactions. It's the one that sounds the alarm bell really, really loudly. And that brings us right to the main event. What happens when IgE sounds that alarm, but for something totally harmless? This is what we call hypersensitivity. It's an excessive, completely out of proportion immune response. This is the moment the fortress starts firing on itself. The military has a term for this, friendly fire. And it turns out our immune system has 4 different ways it can cause this kind of collateral damage to our own body. We're going to walk through each one because they really explain everything from seasonal allergies all the way to autoimmune diseases. Okay, type I. This is the classic allergic reaction that most of us think of. It's a fast and furious response, and it's all driven by that IgE antibody. Within minutes of being exposed to something like pollen or a bee sting, cells called mast cells just dump a flood of chemicals like histamine. And that's what triggers all those familiar symptoms, the sneezing, the wheezing, the itchy hives. Now, type 2 is a whole different beast. Here, the immune system directly targets and destroys our own cells. It's a tragic case of mistaken identity, where IgG or IgM antibodies literally tag our own cells for destruction. The textbook example of this is a blood transfusion reaction, where the body viciously attacks incompatible blood cells. Think of type 3 as the messy aftermath of a battle gone wrong. These little pairs of antigens and antibodies are like battle debris. They're supposed to get cleaned up, but in this case, they get stuck in tissues, like in your joints or your kidneys, and just sit there, causing chronic inflammation. This is the mechanism behind a lot of autoimmune diseases like lupus and rheumatoid arthritis. And finally, we have type 4, which is the slow burn reaction. This one isn't driven by those fast-acting antibodies. No, this one is run by the T cells, our ground troops. the reaction is delayed, taking a full 1 to 3 days to really show up. And that explains why the rash from poison ivy or the little bump from a TB test takes a couple of days to actually appear. So let's circle back to that type 1 reaction, but let's imagine cranking it up to 11. This is the scenario where the system doesn't just overreact, it goes into a full-blown system-wide panic. This, my friends, is anaphylaxis. So let's be crystal clear about the definition here. Anaphylaxis is rapid, it is severe, and it is a true medical emergency. It's the ultimate worst-case scenario of that immediate type 1 reaction, a total systemic meltdown that can affect every part of the body and can absolutely be life-threatening. And what can trigger this kind of code red event? Well, the crazy thing is, it's often stuff we encounter every single day. Foods like peanuts and shellfish, common medications like penicillin, or just a simple insect sting. It's a pretty stark reminder of how a normally harmless substance can become a critical threat in the wrong context. So, in a true medical emergency like this, what's the protocol? The response has to be just as fast as the reaction itself. And while the first step is always to check the person's airway, the absolute #1 life-saving treatment is intramuscular epinephrine. It works incredibly fast to counteract all the dangerous effects, the swelling, the constricted airways, the plunging blood pressure. After that, yeah, you get them oxygen, IV fluids, and other meds, but getting that epinephrine in immediately is the crucial life-saving step. Okay, so we've seen the reaction and we know how to handle the emergency. But how do we figure out the specific trigger and come up with a long-term plan to avoid it? Well, that's where the detective work comes in. Two of the main tools in this detective kit are skin tests. You've got patch tests, which are often for things that touch your skin, and then you have intradermal or prick tests. They both work on the same basic principle. Expose a tiny little area of skin to a suspect, and then you watch to see if there's a reaction. It's a really direct and highly accurate way to find out exactly what the immune system is freaking out about. And skin tests are just one part of the whole diagnostic toolkit. It always starts with a really detailed patient history. Then you have things like blood tests, which can look for high levels of certain white blood cells called eosinophils, or they can actually measure the amount of that specific IgE antibody in your blood. In some rare cases, doctors might even use something called provocative testing, where they give you the allergen directly, but in a very controlled, safe medical setting. We've spent this entire time talking about an overactive immune system, right? An army that's a little too trigger-happy. Now, for a minute, let's flip the coin and look at the opposite problem. What happens when the fortress walls are weak and the defenders are asleep at their posts? And there are two main ways this weakness can happen. First, there are primary immunodeficiencies. These are genetic. You're just born with them. The immune system wasn't built correctly from day one. Then you have secondary immunodeficiencies, which are required. This is when something happens later in life. An illness like HIV, a treatment like chemotherapy, or even just severe malnutrition that comes along and just knocks down the body's defenses, leaving it totally vulnerable. And so, we're left with this really fundamental question. Our immune system has to walk this incredible razor's edge. It has to be a ruthless killer, ready to take on any threat, but it also has to have perfect discipline to know exactly when to hold its fire. Understanding this delicate, incredible balance isn't just an academic exercise. It's the key to treating so many human diseases, and it's the key to really appreciating the amazing, complex, and sometimes self-destructive fortress that's inside all of us.